Thanks, Tuck. Well, we are all busy these days, and it's easy to forget to take care of yourself, your health, especially if you're feeling okay, right? But our next guest says it is crucial for especially women to take the time to keep current on 5 really important tests that could help keep them on a healthy path. Joining us this morning, Dr. Assil Saleh with Foxhall Internists. And Dr. Saleh, thank you for joining us this morning.
My pleasure. Thank you, Allison.
I think what happens with women is that we're so busy taking care of everybody else, you know, the kids, and making sure this is run, that sometimes we forget about ourselves.
You're absolutely
Not
right.
smart.
You're absolutely right. We're so busy in our day-to-day life. We're the caretakers for our kids, for our parents, for our sisters and siblings and so on, that we tend to leave our health behind. We tend to forget about taking care of ourselves. And that's not practically necessarily a good thing, because by doing so, we actually are neglecting our family's health.
Right.
So research shows that if we take care of our health, we're actually taking care of our family's health at the same time. We're role models for our children, for our daughters. So it's crucial, particularly this week. This is Women's Health Week. So it's crucial for us to make that as our priority this week and then for the future, to go see our healthcare provider, discuss your health issues with them, go through some preventative routines that every woman should know about. And there are many out there, but the five things that one would focus on would be, 2 of them would be cholesterol and blood pressure checks.
Okay. And we often think cholesterol, especially, is a man's issue. I don't know why we think that, but we do.
Absolutely,
right.
Absolutely. Both of these are risk factors for cardiac disease, and cardiac disease is the biggest killer in women. It's just as common as in men. We tend to forget about it, preventing cardiac disease with blood pressure checks, cholesterol checks, keeping active, physically active, exercising 15 to 20 minutes a day would be crucial in trying to prevent further cardiac disease.
As little as 15 minutes a day can make a difference.
15 to 20 minutes a day can make a difference every day of the week, or at least 5 days a week can truly make a difference. Okay. Exercise, keep your weight under control, keep your stress under control, and don't take any habits that could be harmful to you, such as smoking or not wearing your seatbelt.
I'm sorry, go ahead, doctor.
The other couple other issues that one has to be careful about not missing while visiting your doctors are breast exams, mammograms, and those can be done every 1 to 2 years, starting from the age of 40 onwards, or of course younger if you have a family history or if you have risk factors. So breast exams and mammograms are again crucial in preventing or early detection of breast cancer and breast issues. Another one, of course, is pap smears, and particularly in early detection of cervical cancer. The earlier we detect cervical cancer, the better the outcome.
The last one you have is bone density, another one we might not think about.
Yes,
right.
Yes. And this is a crucial one, because we've come to find out that a lot of women develop osteoporosis in their 50s, or even at a younger age if they have a family history, or if they have other risk factors for osteoporosis. So bone density starting from the age of 50 onwards, or even younger if you have risk factors for osteoporosis, they're crucial, and they can be repeated every 1 to 2 years, again depending on the situation that one faces themselves with.
Appreciate you coming and reminding us about this again. Blood pressure, pap smear, mammogram, cholesterol, and bone density, the 5 tests that you say, and that physicians say are the tests that we should get. And why not do it during National Women's Health Week, right?
Absolutely.
Dr. Saleh is with Foxhall Internists. Again, we appreciate you joining us.
Thank you very much for having us.
Steve, over to you.
Allison, thanks very much. 8:38 on this Monday morning. Coming up next, a startling